Now, lots of people around the country are obsessed today with transparency about prices. And if we just have transparency about prices, it will fix everything. The problem is it will not fix everything. So let me look, for example, I got two providers. They post their prices. Provider number one, $25,000. Provider number two is $23,000. Provider number two is the better choice, right? Well, what if number one has a lower complication rate? Such that when you add it all up, it turns out that the total amount that ends up going to provider number one is lower than provider number two. That's why your quality path initiative is so important, because you can't just look at price. You have to look at quality. And what you really want to do is to have these bundled and warranted payments so that the providers can come to you and give you an all-in price for that care. Not suddenly notice that all these extra charges appeared after you put in this program. Those bundled and warranted payments allow you to compare apples to apples, and the same thing at the condition level. Now, one other thing I'll just mention to finish my story. What did I do? I flew to Pittsburgh and I drove to Cleveland. How much did it cost me to go through Pittsburgh? It cost me $188 to do that. Nonstop, no Philadelphia. No drinks, but still nonstop. So why was it so much cheaper to go to Pittsburgh than to Cleveland? Is it that much closer? Well, yeah, it's 70 miles closer. Is this modern airfare $900 to go 70 more miles? The difference was there was only one nonstop choice to Cleveland. There were three choices to Pittsburgh. So what you have to think about is, in your community, as all these accountable care organizations are forming, are you going to have several or are you going to have one? Because if you want to get some price competition, you have to have choices for people to be able to make. Now, both benefits and payment are controlled by health plans today. But guess who controls health plans? It's purchasers. And purchasers working together through a strong purchaser coalition like the Alliance are in a position to make those health plans change. And the reason that you need to be thinking about that is because health plans have no incentive to change. I'll tell you why in a second. So what if they won't change? Well, you purchasers need to say, we're going to switch health plans. And the experience nationally of health plans is that you are all big bags of wind. You won't actually change your health plans if they don't want to do something differently. If you do, they will change. Trust me, they will change. But recognize, they have no incentive to change. If you're a self-insured purchaser, for the health plan to change payment models and everything else, they're going to have to spend a bunch of money to implement a new payment system. And if it reduces spending, where's the savings going to go? To you. Not exactly a good business model for the health plan to spend all the money to put the new payment system in and you get the savings. So is it any wonder that they're kind of dragging their feet about doing all that stuff? They'd like to have that claims payment system of theirs last for a while longer. The best approach is for you to actually sit down and start talking directly to the providers, because you, the purchaser, and they, the provider, are the ones who actually have your interests aligned. Because you win if they figure out how to compete and deliver lower cost, higher quality care. They win if you pay them in a way that actually rewards them for doing that, and so that they can actually get paid when they keep the patients well. Now, what happens to the health plan? Well, the health plan's still there, but the health plan does what you and the provider, your true partners, your true contractors, your true suppliers, say they need to be able to make this work. Now, you generally need a facilitator of some kind to help this happen, because there isn't a lot of trust today between the people who are buying health care and the people who are selling care. So getting a neutral facilitator who can help some of those discussions, who can provide some technical assistance and some data. And fortunately, you actually in Wisconsin have mechanisms for doing that through the Partnership for Payment Reform and the Wisconsin Health Information Organization to provide the data that you need, claims data with prices, to be able to do that analysis and to help you talk to each other. But you have to be willing to talk to each other to be able to do that. So what would I say employers should be doing? I would say you should start working directly with those providers to look for those win-win-win strategies to be able to reduce the cost of care? Where are the opportunities today for reducing costs without rationing? And what payment reforms and benefit changes are needed to be able to achieve those things? Get and analyze the data. It's data that you both have to trust, and then work on that basis to figure out how you divide up the risk. You've got to look at both utilization and pricing. You've got to get data on quality. Again, that's where your quality path initiative is really important, so that you're not paying for poor quality care. And then you got to say, we're going to use health plans that will pay that way, because that is the biggest barrier for the folks who want to, in the healthcare system, that want to change, do that. Now, I don't have a book, but I've got lots of free publications that you can read, which you can download from this site if you want to. And I would encourage you to learn as much about this stuff as you can, because it is very important and it is very complex. It is admittedly complex. But, you know, we have 7,000 CPT codes today and 700 DRGs. This stuff I'm talking about is nothing compared to the complexity of the current system.